What's going on, everyone? Happy Friday. Hopefully, everyone is doing well, staying safe, healthy, having a great day so far, and of course, most importantly, testing negative for all those viruses if you had to take a test. It is time now for the Friday edition of the Virus Update for Friday, October 17th, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. There's a lot of viruses out there, but not enough information is being circulated to inform you of what's going on with these viruses. I give you the latest levels, data, news, wastewater, and really anything I can find to help keep you safe and informed of what's going on. Want to stay informed? Just subscribe to my channel down below. Give this video a thumbs up. Hit that notification bell. Share this video with anyone you know. And of course, leave your comments down below. Already, we do have several things to take a look at today, starting off with some weekly reports in Australia from Dennis the COVID Info Guy. Then we're going to take a look at the UK, Canada, some news, and some other daily stuff as well. And unfortunately, we do have some news that we have to talk about when we get to one state later on. Something that we look at quite often is now changing to only one time a week. Yeah, and of course we'll end with a few wastewater sites. Starting off with some Australian reports. South Australia, weekly respiratory update, October 11th to October 17th, 2025. Reported cases of COVID, 86. Hey, that's down by 30.6%. Flu, 514. That's down by 28.9%. RSV, 217. Down by 19.9%. Pertussis, whooping cough, 65 cases of that. That is actually down by 10.9%. Reported deaths in 2025. COVID, 64. Flu, 26. RSV, 5. Pertussis, 0. That was South Australia. Now let's go to Western Australia, where weekly COVID update ending on October 12th. COVID positivity rate, 1.8%. Hey, that's stable at this time. PCR cases, 93. That's up by 4.4%. Hospitalizations decreased to an average of 25 per day. Hey, that's down pretty big. 26.4%. ICU, 7-day average remained at 0. That's up by 0.0%. And now moving on to COVID-19 outbreaks in Australian residential aged care facilities up to October 16th. Active cases, this is not good. 283, that's actually up by 32.8%. Active outbreaks, 51, up by 15.9%. Resident cases, up by 34.5%. Staff cases, 57, that's up this week, 26.6%. And 4 more deaths have been added, bringing the total to 395 this year. Obviously, they are going to pass 400 at this rate. And I always like to point this out. We're going to do it again. 2020. Residential aged care facilities. We call it nursing homes here in the United States. They call it aged care facilities. They had 686 reported deaths in 2020. It went down to 226 in 2021. Then we got to that period where many countries, people thought, oh, pandemic's over, COVID's not a big deal anymore, blah, blah, blah. Yeah, 2022, 3,855 reported deaths, and it remained above 1,000 in 2023 and 2024 with, over 1,300 in 2023 and 1,078 in 2024 and now 395 this year. All right, moving on to this. Victorian weekly respiratory surveillance report. This is still in Australia up to October 17th. And we do see the COVID positivity rate is 2.1%. That's down slightly. COVID cases, 418, down by 3%. Influenza A, 1,550 cases. That's down by 20%. Influenza B, 203 cases, down by 45%. RSV, 408 cases, or down by 9%. All right, we have to move over to the UK now. And we're starting off a little bit different today. We usually start off with COVID. We're starting off with flu there. Why are we starting off with flu? Because flu is starting to get serious in the UK. It's going up pretty quick now. The positivity rate for flu in the UK up to October 12th is now at 6.8%. You can see there is a clear trend upward. And you can see that started. They might have done a little correction here. That started back in September, and it's gone up ever since. Back that up to last year, they didn't start seeing big rises until November. So flu is going up a little bit earlier this year, and it's going up rather quick. I'm concerned how bad this could get. Of course, last year, they got all the way up to 27% positivity rate. Will they get there this year? Only time's going to tell. And you can see this is among all age groups in the UK are now experiencing a rise for flu. So this is not a good thing whatsoever. What is a good thing? Well, COVID. I was going to show you RSV, but let's do COVID now. Then we'll do RSV. Yes, the COVID situation did get slightly worse. We did not see as big of an increase. This is telling me maybe, finally, this COVID wave in the UK is about to peak. 3,206 weekly cases. That's up by 1.9% or 61 cases. Deaths, 100, up by 14.9% or 13 cases. Healthcare, 2,077 people. Again, I don't know if that's actually, it says September 30th. I don't know if that's actually the current number. And that's up by 183 or 9.7%. Positivity rate, let's go down to that chart, shall we? And we do see the positivity rate for COVID. We did flu already. The positivity rate for COVID in the UK did peak at 13.38%, and now it is starting to drop. It's down to 11.89% as of October 10th. So I'm seeing indications here that the COVID wave has peaked in the UK. We shall see. Let's see what it says next week, but it's not going to do much favors for the hospital, even if the COVID wave is peaking. You got other viruses that are going up. We talked about flu. Take a look here. You can see it very closely. Look real close there. It says a little bit of an increase now now you can see it here better. It's a bit of an increase now for RSV positivity rate. It's over 1.15% now. It's over 1%. So if that's going up, flu is starting to go up. Unfortunately, this is going to lead to a rise in healthcare. And you can already see it here. There is starting to be a rise in healthcare there. Let's go back to influenza just for a second. Can we take a look at the healthcare for influenza? Yeah, there's tiny increases now for healthcare usage. So while COVID may start to improve soon, the wave of more patients being in the hospital is not going to be over with. And eventually, there'll probably be a winter wave of COVID in the UK. I don't know what that's going to look like because this has been a long and pretty big COVID wave. So that may hamper how big the winter wave gets there, unless, of course, we see a new variant pop up. All right, let's go to Canada now, shall we? There is a change here today, which is why we're doing this. A moderate for COVID-19 in wastewater activity level. Flu A is low. Flu B, it's showing up not detected. Okay. RSV is listed at low at this time. All right, taking a look now in the United States from Sci-Fi. U.S. regions 6 and 10 have record low positivity year over year. He is reporting at this time. And if you don't know where regions 6 and 10 are, that does include states like Texas, Oklahoma, Arkansas, New Mexico, Louisiana, and then region 10 would include Alaska, Washington, Oregon, and Idaho. So, hey, that is some good news, and we'll take any good news when we can get it. COVID is still dropping here in the United States, and in some places, it's actually picking up the pace. In other words, dropping even faster. This is some really good news. Now for some not so good news. California officials confirm its first U.S. case of severe Mpox strain with no travel history. We have been seeing an Mpox detection in wastewater, I believe, in one of the wastewater sites there. So, yes, this is not a good thing whatsoever. The first U.S. case of the more severe strain of Mpox without any recent travel history has been identified in California. So, he had to pick it up somewhere. And that other person he picked it up from probably had traveled somewhere. So, my guess would be is there's someone else out there who either has or had Mpox and somehow gave it to another person, and that person who has or had it just never got tested for it, or something like. Health officials said this week that the case was confirmed in a Long Beach resident. The patient required hospitalization and is now isolating and recovering at home. So that is good news that he's at least recovering at home. Yikes, yeah, that's not good whatsoever. Now moving on to this in Texas. This is the Austin, Texas area, I believe. Around 100 students experiencing stomach illness at Keeling Middle School, letter says. Yikes, this is not good. Families of students at Keeling Middle School were notified after around 100 students were sent home early or were absent Thursday due to a reported stomach illness, according to the letter. And it does sound like this could be either some sort of a stomach bug or a norovirus at this time. And it looks like they're going to do the usual sanitation and tracking to see what is going on. So, yes, it sounds like there is going to be a deep cleaning of the schools. And it says right here, GI symptoms, nauseous, vomiting, or diarrhea. Again, this school is going to be getting a deep clean. This is, of course, not a good thing whatsoever, and it will make it here to my website, to the tracking threads. I might have already added that. Hey, I gotta say something. I can't believe we are getting a lot of attention in these tracking threads. Like, look at this. The sports illness thread. It's now been viewed over 21,000 times. And I've noticed we're starting to show up in Google searches. I mean, there really isn't anyone else who's tracking this stuff and keeping a log of what's going on. I think it is very important that we continue to do this, and I'll be having some updates probably coming to these threads later today, because I'm going to be doing more searches later on. And let's go to that school illness thread. Where is it? Right here. Yeah, it's on page 2 already. We haven't even hit the peak of school illnesses yet. That's coming in a month or two from now. And did we add that school from yesterday? Yes, we did. And also, there's a school in Hawaii dealing with problems right now. And chocolate milk is being recalled at that school in Hawaii. Yeah, not a good thing there. All right, moving on now. Let's take a look at the migration of birds, which, of course, you know, could potentially spread bird flu here in the United States. Alrighty, you can see here, birds migrating to the south. Yeah, it reached near or just over 100 million once again last night. In fact, almost 200 million. But we're watching the migration of birds because bird flu has been picking up the pace once again, just as measles has been picking up the pace once again. Yeah, there's a lot of viruses coming back that we dealt with early in the season, and now they're coming back once again. Hey, we're coming into wintertime, so wintertime tends to lead to more spread of viruses. Let's take a look at what's going on now with the air qualities in the United States. While we wait for that to load, let's pause and take a hydration break, shall we? Take a look at this. We do see here poor air qualities listed on the West Coast today, and some poor air qualities in the plains as well. Yeah, and actually just a little bit to the east of the plains. Chicago area, not great, but California, Oregon, Washington, yeah, terrible air qualities for you. Not bad in the east, and some of the southeast states, not including Florida, but Alabama, Louisiana, Mississippi, some minor issues for you today. All right, let's take a look at that measles update since that's the next tab here. We might as well. I mentioned it a moment ago. We're now almost at 1,600 cases. I'm starting to think we probably will pass 2,000 cases this year. I've already tweeted a measles alert this morning, and I'm sure I'm going to find more things in relation to measles as we head into the weekend. I don't think we're done with measles just yet. All right, moving on. Where do we want to go next? Pinellas County, Florida, of course. And take a look at this. We do have just a wide range of different calls going on right now. Sick person showing up multiple times. Taking a look up here in Philadelphia. Wednesday, 795 EMS incidents. Thursday, 710 were reported. Live looking at Montgomery County shows we currently do have some calls going on right now. In Chester County, Pennsylvania, I've been seeing sick person listed quite a few times this morning. Let's keep refreshing this. Eventually we'll get this to come up. Yeah, still seeing that 1, 2, 3 times right now. It was listed 4 times earlier. And where you see 2 here, there was another one within that. So, yeah, there's been a lot of sick person calls this morning. Respiratory difficulty showing up as well. And reminder, sick person doesn't always mean someone's sick on some of these dashboards. Sometimes that is miscellaneous. Maybe they need, something wrong with a catheter, or just some random thing, but it can also mean people are sick, though. I mean, heck, it is called sick person after all. In Bucks County, Pennsylvania. Well, you saw, I had this refreshed before the video. It was 4 calls, and now 4 have become 10. So the number of calls there have gone up in Bucks County, Pennsylvania, being just north of Philadelphia. Pennsylvania hospitals, wait till you see this, not doing all that bad today. Actually, That's not Pennsylvania hospitals. We'll take a look at that maybe tomorrow. That's wastewater for Pennsylvania. Sometimes it updates on Saturdays. Pennsylvania hospitals not doing bad. A few hospitals in Southeast PA. None in the Lehigh Valley dealing with problems today. New Jersey does have a few problems today. AHS Newton Medical Center is dealing with a specialty issue. Cooper University Hospital, full and total divert for patient volume. And Inspire Medical Center Mannington, specialty issue, surgical divert. We probably read this off multiple times a week. I seem to recall reporting about it several times a week. All right, New York State. This is the state that we have two things to tell you about. First off, COVID cases. Take a look at this. It was going down, and look at the end there. Yeah, the trend line. It's dropping even faster. That's some really good news. 358 people tested positive. Now, some not so good news. And that would be this. Yeah, unfortunately, New York State is making a change here to the hospitalizations. Note, as of 10-7/25, because I happen to scroll down here and take a look, say, is there any notes? Because sometimes they put these notes down here. Because remember, we haven't seen this update in a very long time. There's a reason for that. This data will be shifting to a weekly update. Yeah, that's not good. This dashboard will be updated to a weekly display to reflect that. So, yeah, this is only going to be weekly now that we see this. So, sorry, folks. New York State hospitalizations. One less thing. I mean, we don't have the CDC right now. We don't have a whole bunch of different things. This is getting really ridiculous. We're coming into winter time where viruses go crazy, of course. We're not at the next COVID wave yet, but when we do, we want to be able to track what's going on. Thank goodness we still do have wastewater. We'll look at that in a moment. Take a look at this. In Ohio, this is the weekly update. RSV. 6 people hospitalized for that. That is up from 4 the previous week. Flu, hey, that's down. 10 versus 17. COVID, 143 people hospitalized. That's a significant drop versus the previous week. That's 210 right there. Now, before I show you a few wastewater sites, we don't have any updates from the CDC. I want to show you something I found because I was refreshing the CDC Nowcast page. You know, this dashboard right here. I want you to see something. I think this is extremely important for me to show you. And who knows, I might even incorporate this into the title of the video today. This is really important. This is published SARS-CoV-2 sequences. And if you don't know what that is, you know, we talk about all these different variants. And here's one right here. I'm going to hold up a piece of paper. I got BA.3.2 written down. There's a reason why I have that on a sticky note. It's an up-and-coming subvariant of COVID. It's showing up in a few different countries around the world. And some say, well, if that takes off, that could be our problem for the wintertime. And it would be a pretty big problem. Here's the deal when it comes to these different variants. Let's read first. CDC collaborates with state and local public health laboratories and partners such as the Association of Public Health Laboratories to increase the number of specimens that are sequenced as part of the National SARS-CoV-2 Strain Surveillance Program. Here's the deal. When people test positive for COVID, you know, the PCR test, they take a small sample, and I do mean really small sample of these cases and sequence them for various different variants, such as BA.3.2, or such as XFG, NB.1.8.1, and MW.1. You get the point. They sequence them. Here's the problem. Let's go all the way back to, where are we going to here? 2021. You recall, and we got to refresh this. You recall in 2021 we had a really big wave that winter. We had some big waves back in the day. But the point I'm trying to get across here is, take a look here. We were doing a lot of sequences per week. At one point, it went all the way up to 90,000 sequences per week. That's a lot, my friends. Fast forward to today, 700 a week. 485, and it says source PHL. I don't know if that actually means Philadelphia. I honestly don't really know what that means, but you get my point here. That could be the PHL CDC office. There is a CDC office here. We're not sequencing enough, so things could fall between the cracks, and we could miss some variant detection of COVID here in the United States. So just wanted to show that to you. Let's take a look at 2 wastewater sites. Let's go down to Mpox, shall we? And you can see here, in the San Francisco area, I believe it is. Yeah, look at this. 2 detections of Mpox. That is the Clade 2 strain of Mpox. Clade 1b, is that showing up anywhere? No, we're not seeing that show up anywhere. And you know what? Tell you what, I will do you a favor since we just looked at the San Francisco. Let's just do the 2 wastewater sites, make them be San Francisco. Haven't done that in a while. And you're going to see some good news here. COVID's down. A little bit of an increase at the end. I don't know if that's something we have to watch or not. RSV, it's definitely showing up now. Influenza A is showing up. EVD68 is showing up. And norovirus is low at this time. That's the Oceanside wastewater site. And taking a look at the eastern one, COVID still dropping. RSV, some detections, still very low. Same with influenza A, still very low, but some detections. HMPV low. EVD68 is listed high, and norovirus is medium at this time. All right, we're doing a bonus wastewater site. We're going to go somewhere in the east now. How about we come up here to Newark, New Jersey? Haven't been able to do that in a while because it's been pretty much, yeah, it hasn't shown up lately. But take a look at this. Newark, New Jersey. COVID, it's going up a little bit slightly there. So something we'll have to watch. I'm not terribly concerned. Everything's really listed at low. Norovirus has been trending slightly higher. And look at this. Mpox Clade 2 was detected back in September 19th. Alrighty, folks, we'll have some more wastewater sites over the weekend. We're going to take a deeper look at the Northeast this weekend. Yeah, that Columbus Day weekend, leaf peeping last weekend, that may be causing some issues in the state of Vermont. But you'll have to check back this weekend for that Wastewater Sunday, or we may even get it in there tomorrow. So there's a little bit of a cliffhanger for you for the weekend for you to come back and check my updates. If you enjoyed today's update, give it a thumbs up. Subscribe down below. Hit that notification bell. Share this video with anyone you know, and leave your comments down below. I will see everyone again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Friday afternoon. Thanks for watching.